Hey guys, welcome back to the channel. Today we have Dr. Thomason on the channel for our second episode of Trail Trauma. Today we're going to be talking about a video that involves broken ribs, things you should know about broken ribs, maybe how to identify them on the trail, and also some do's and don'ts, again, when you're with a friend and there's a trauma on the trail, what you should and shouldn't be doing.
Okay, let's get started.
Don't break.
All right, so
So first off, this is how I mountain bike.
yeah, we've got a rider here who
just turn.
is on a pretty technical trail who doesn't seem that
Back
experienced. We got his buddy kind of coaching him on how to just
You do this.
do a
Fine.
drop in.
Go for it.
He's going.
And this one's nice because we got it from a couple of angles, and there he
Oh.
goes over the bars.
Did a little endo. That was cute.
Man, he comes down hard too.
He really hits. Oh, and now we have another view too, so that's kind of cool.
Oh, shit! Oh, fuck.
Bad. And, I mean, classic scenario where rider's got his seat too high, goes over the lip of a jump in a seated position. Of course, the seat hits you in the butt. That kicks you over the bars. We see this all of the time with riders who do OTBs.
Yeah. And especially regardless of the situation, if you have a friend who goes over the handlebars like that, the big concern is right away head and neck trauma. Just because, I mean, even if he's breaking mostly with his hands and wrists, I mean, the impact on his head, even with a full face, is going to be pretty big.
Yeah, I think probably the most common injuries that I think people are going to see when you see an OTB is neck, shoulders, ribs, right? These, especially the wrist, these are the main points of contact when people go over the bars.
And your collarbone. That's a big one, especially with full face mat.
Oh, shit!
Oh, poor guy.
Oh, fuck.
And then here comes my favorite part of
Oh,
crash
fuck.
videos,
You
which
okay?
is when people get the wind knocked out of them.
Slow.
The groans.
Slow.
Oh.
Man, he is.
Slow.
And then no, don't do that.
Yeah. I think, and maybe you can talk about this a little bit, but I think that a lot of people, when their friends are involved in an accident, the first thing they want to do is kind of rush to help their friend, right? Get their hands on them, roll them over, touch them, move them. It's okay to just give your friend some time to catch his breath, because when they're in this state where they're constantly, they've got the wind knocked out of them, they can't communicate to you where they're feeling pain, if they're hurt, and people immediately want to get their hands on them and start moving them and things like that. And it's just let your friends, I know you want to help them, but just let them get to the point where they can communicate to you.
Yeah, it's really okay to let him lay. Even if it's in the mud, it's okay to let them lay there until they can better tell you where their injuries are. However, on the flip side, if they're knocked out, if they're unconscious and they're not responding, it's okay for you to kind of either shake their leg if it doesn't look injured, just to get some sort of response to make sure that they're okay, check that they're breathing, and check that they have a pulse. And then also too, sometimes leaving the face mask on, leaving the goggles, even if it's not the most comfortable thing, you just don't know necessarily what facial trauma they have, and maybe pulling off that mask could have caused some serious damage. So always think about that.
Yeah, and we're going to see again, this guy's about to do one of the cardinal sins when someone's involved in an accident. You can see it coming. You don't know if this guy has a neck injury, and he's going to remove the helmet from this rider, which is, again, a huge no-no. You should never do that. You don't know if he's got a fracture that's hanging on by a thread.
Yeah, poor guy. But, I mean, that's kind of the big crash for him. His friends have no idea other than that he's fallen. And it turns out, later on in the video, we find out he does have 8 ribs that are fractured, which is kind of the big discussion for us today. With these big traumas where he's kind of going over his handlebars, landing on his side and chest, you do want to be worried about rib fractures. For him, it is a good sign that later on he is breathing on his own. He doesn't seem to be really short of breath or gasping for air. Not in this moment, but
Yeah,
is a big thing.
it does take him a little bit of time to kind of get his breath, but as you'll see, he does eventually get to the point where he sits up, he's breathing, he's communicating, he's able to kind of tell people where his pain is. But yeah, I think rib fracture, especially in this video, because I'm a little surprised that the guy is able to just kind of sit up, move about, even though he's got 8 broken ribs, which to me, as someone who's not a medical professional, sounds like a lot of broken ribs. And the fact that someone can just get up, walk around, and maybe not even know that they have broken ribs, just think that, like, I'm in a lot of pain, but I've also just taken a crash. It's one of those injuries I think that's maybe hard to detect.
Definitely, especially if you have a single fracture in each of the ribs. People can get up, they can walk around. Most often, after getting an x-ray just to confirm that you don't have any damage to the actual lung and making sure that those rib fractures are still in place, there's really not too much to do other than pain control from the physician's end.
Yeah, which really surprises me. I'm not familiar with breaks and fractures and kind of how they heal. I'm used to someone breaks their wrist, they essentially, you put a cast on it, right? And then you let that heal over time. But my understanding is that with ribs, there's not much that you can do, right? It's just that you just have to let that fuse back together over time. I mean, are there more severe complications that can come from broken ribs?
Oh, absolutely. So typically what we see with rib fractures, if you look here, just these typical fractures, and ribs are very flexible for the most part, so they can heal on their own. You can actually see there's this great CT scan, not to get a little too technical, where you can see the rib fracture, rib fracture, rib fracture. So the big complications, though, is with those sharp bone fragments and your lung is so close, you do have to worry about possibly what you would call a punctured lung. And that's just where your lung basically ends up deflating. So that's a really big complication, even with just single fractures like this. And then lower down too, you can kind of see you have pretty major organs that your lung or your ribs kind of go over, which is the liver and spleen. So you do have to worry sometimes with those lower fractures that those might be involved. And then a big one is with all of that pain, it's really, you do have a high risk for developing pneumonia after the fracture. So that's why a lot of times when patients have rib fractures, even though we don't necessarily do any casting, we don't do surgeries for it, but patients are often prescribed pain medications and recommended to take deep, full breaths in so that your lungs stay nice and inflated and decrease your risk for pneumonia. Now, the worst case scenario that we hate to see, this one makes me cringe just thinking about it, is what we call the flailed chest. So this is the best image. Chest x-rays are hard to see with rib fractures, but there's a fracture here and here on the same rib. There's a fracture here, and then a big nasty fracture is down here and here. So what ends up happening is when you take a deep breath in, instead of your chest expanding like it normally does, that fractured region actually compresses in. And why that's important and why oftentimes those patients do have to go to surgery for correction is now that lung can inflate. So that's really the big complication for that, and that is a surgical emergency. But again, with chest or with rib fractures, with all that musculature, and especially if the person has more muscle or body fat, it's sometimes hard to see minor rib fractures like this, but with a flailed chest, you will see that chest wall kind of going in when a patient takes a deep breath in.
Yeah, and I'm really surprised. What we're seeing here is the guy gets up and walks off. Yeah. I mean, they do take him to the hospital. He does get an x-ray, and obviously that's how he finds out that he has 8 broken ribs. But I'm just amazed that, with something like rib injuries, that people can just get up and just walk off the trail. I mean, the guy's probably in pain, but he's probably thinking like, well, yeah, I just went over the bars and I just had a hard slam. I got the wind knocked out of me. I mean, I'd be surprised if this guy had no idea that he had 8 broken ribs until they took the x-ray and then realized, and they told him, you have 8 broken ribs. And I think that's kind of one of the things that are scary, is that if you have an over-the-bar situation, you might think to yourself, like, I'm just in pain because obviously I took a hard slam. you really, if you have, I would recommend with anyone who has an over the bar situation, go and get checked out. This guy probably knew he was in pain, but probably had no idea the severity of his crash. And thankfully, they took him to the hospital. He was able to get an X-ray and see that he has 8 broken ribs. So, yeah, guys, if something, when it comes to trail traumas, it's not something to be taken lightly. Anytime you have a hard crash like that, you need to go and get checked out, whether that be at an actual hospital or even just going to, something like one of those quick minute, where they can at least take X-rays and make sure that everything is fine. All right. That's it for this episode of Trail Trauma. Like and follow, subscribe for more videos like this. We're going to have Dr. Thomason on more frequently, and we're going to be talking again about the do's and don'ts of what you should and shouldn't be doing on the trail. Thanks for watching.
Bye-bye.